Welcome back. With me today is Dr. Michael Port, an interventional pain medicine specialist. Welcome, Dr. Port. Good to see you. You're with the DISC Institute?
Yes.
Or with DISC?
DISC, Diagnostic Interventional Spine and Sports Care.
Okay, tell me about it.
It's basically we're an integrated medical group that encompasses essentially all aspects or comprehensive spine and sports care. So what that means is we have, on the spectrum of medicine or spine care, we have everything from the non-interventional or conservative side, physical medicine, PM&R, physical therapy, soft tissue chiropractors, to interventional pain medicine like myself, which are more minimally invasive type procedures, and then on the sort of further end, surgical or real open surgeries.
What's the benefit of interventional?
Interventional pain medicine. The benefit is that it allows to a targeted, specific diagnostic and treatment or therapeutic approach. So what that means in lay terms really is the ability to help diagnose or figure out what's going on, as well as treat what's going on in a minimally invasive fashion, which means that you can have your procedure and go home the same day and be eating lunch by that afternoon.
That sounds good. Now, what are some of the issues that people deal with that can have that light kind of treatment?
A very common example would be a herniated disc. So the discs are cushions in the spine between the bones, and people can be going about their daily life and may have a sports injury or may just wake up with a disc herniation, and it can irritate a nerve root, which causes severe kind of disabling type pain, and it can happen to young people or older people or any age, and that's the type of diagnosis or problem that's very amenable to the type of treatment that I do.
And what do you do with the herniated disc?
Well, first patient would come in with pain, we'd work them up, evaluate them, usually with an MRI and maybe x-rays, and in our facility we have everything integrated, meaning that we can pull up the images at disc into the operating room on a flat screen, so I can not only see it myself but go over it with the patient, and then usually some type of interventional treatment. So that means a x-ray guided procedure, usually with a little bit of sedation, or they can do it under straight local anesthesia where they're wide awake, and depositing a little bit of steroid and local anesthetic right around the nerve root.
Right, talk about the nerve root. Now, not all pain in the back is due to a herniated disc, isn't that right? Right.
So as I mentioned before, the specific or target-specific approach that I like to employ is, from a diagnostic standpoint, trying to figure out what's going on. So there's a lot of things that can be hurting you in the back. The back is a very complex machine, and the MRI is a tool to help figure out what's going on. The x-rays are tools, the physical exam and the history, but ultimately it can come down to sort of a series of educated guesses, and sometimes a very target-specific approach, meaning the facet joint, which is one part of the spine, or the nerve root or the disc, can all be culprits in causing the pain. And by using the interventional techniques in a very specific fashion, you can not only help to treat, but also help to figure out what's going on.
How effective in terms of getting this done with the intervention is it?
You know, it's a million-dollar question. People say, well, how long is your treatment going to last? And there's no way to tell. What I always tell patients is, first, let's see if it works. Let's try to figure out what's going on. And if the answer to that is, hey, it worked, the next question is, well, how long does it last?
Okay.
There's certain treatments that I can employ which will last, hopefully, a very long time, weeks, months, if not longer. But even if it's for a short period of time and the pain comes back, it can help to establish a firm diagnosis, so I can hand them off to the spine surgeon and say, hey, you know, I think it's the right L4-5 facet, as opposed to a multi-level disc problem. You can really specifically target the issue, and then it helps, if they do need surgery, it can help to limit the surgery as well.
So you're paring it down to get to the problem.
Exactly.
We've got 30 seconds left. Tell me how DISC is different in terms of its team.
The DISC really was created as a multidisciplinary spine and sports integrated approach. So what that means is it's sort of like a bicycle wheel, and you can enter on any portion of the spokes. So whether you need very conservative therapy, meaning soft tissue chiropractic manipulation, physical therapy, or, as I mentioned, more interventional treatment like the pain medicine side, or ultimately surgical treatment, we have the ability to diagnose and essentially treat. We have operating rooms, we have
different experts as well.
Exactly. Right. We have medical physicians from all of those specialties: internal medicine, physical medicine, interventional pain, neurosurgery, orthopedic surgery, and the facility to be able to treat all those problems with operating room, MRI, CT scan, and office space.
Full service center.
Full service.
Thank you very much. Do you have a website?
www.discmdgroup.com.
When you think health, think IRU.